I want to take a few minutes to talk about your upcoming adrenalectomy. That's the surgery to remove one of your adrenal glands. I know surgery can feel overwhelming, but this is a well-established procedure, and we're doing it so you can feel better and so we can confidently diagnose what is going on in the adrenal gland. To review the basic anatomy and function of the adrenal glands sit just above your kidneys and make hormones like cortisol, aldosterone, and adrenaline. A person naturally has two adrenal glands but can live normally with just one adrenal gland. Why surgery? Sometimes one adrenal gland needs to come out if it's causing problems. Masses can grow here which could be cancerous, or not cancerous but producing too much of a hormone. What kind of surgery? We'll use a laparoscopic approach, which means small incisions on your abdomen and a tiny camera instead of a big open cut. It's less invasive, so recovery is faster. During the procedure, we'll make a few small incisions, usually 3 or 4, in your abdomen. Using the camera and special tools, we'll carefully remove the adrenal gland and check everything looks good. Afterward, we'll watch you in recovery to make sure you're waking up comfortably. Recovery takes a little time, but it's manageable. You'll be under general anesthesia, fully asleep, and the surgery usually takes 1 to 2 hours. Most patients stay in the hospital for 1 to 2 nights afterward. Risks of surgery: there are many blood vessels and other organs near the adrenal glands. The colon, kidneys, pancreas, stomach, liver, and spleen are all nearby. It is possible that these organs or a nearby vessel are injured. There is a small risk that your remaining adrenal gland might not be strong enough to make hormones for you post-operatively. We will check for this and treat with medications if needed. Also, there is risk of wound infection and anesthesia complications, as is the case with other surgeries. The risk of death is very low, but never zero, as is the case with any surgical procedure. How to prepare for surgery? About a week before, we'll review your medications. If your adrenal issue affects hormones, we may start you on medication beforehand. To keep things stable, don't worry, we'll guide you. The day before, stick to light meals, and after midnight, no food or drink. That's standard for anesthesia. You'll need someone to drive you home when you're discharged, so plan for that. How you will feel after surgery. You'll feel some soreness around the incisions. For a few days, pain meds will help with that. You might also feel tired, especially if your hormones are adjusting, but that improves over weeks. The other adrenal gland usually picks up the slack, so you shouldn't need hormone replacement long-term in most cases. For the first week, rest up, no lifting anything over 10 pounds or strenuous activity. You can walk around, though it's good for you. Most people are back to normal routines in 2 to 4 weeks, though heavy exercise waits about 6 weeks. Here's when you don't need to call us. Mild soreness, light swelling, or feeling tired. These are part of healing. A little oozing from the incisions or occasional nausea, especially if on steroids, is normal too. Hormone shifts like mild headaches or feeling off are expected as we adjust your meds. But do call the office if you notice these. A fever over 100.4 degrees Fahrenheit, severe pain not eased by meds, redness spreading around the incisions, or plus these could mean infection. Heavy bleeding soaking a bandage in an hour, or a sudden increase in swelling isn't normal either. If you feel faint, have a racing heart, or extreme weakness, call right away. That could signal a hormone imbalance or rare adrenal crisis, especially if both glands are affected or meds aren't right. Also, if you get short of breath, chest pain, or calf swelling, reach out immediately. Those are rare signs of a blood clot. Follow-up plans. We'll see you a week after surgery to check your progress. We'll monitor your hormones to ensure your body's adapting well. We're doing this to get you back to feeling your best. We will be here with you every step of the way.